Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuvir Deshpande from Pune, Maharashtra State, India, would like to welcome you all in my Ayurveda Academy YouTube channel. As you know, we are making the series that is Ayurveda in GP, that is Ayurveda in General Medical Practice. Today's subject is interesting in that way because many people they think that obesity is the only problem in this era, but I think there are some unfortunate people, they are not having the even normal weight, and this underweight is their basic problem. So many doctors feel that only prescribing some what you can say the tonics, that underweight will problem will be solved. Or you can just ask the patient to do the regular exercises, go to the gym, do the muscle workouts, etc. But I think yes, that is okay, everything is okay, but we must find out, is there any root cause, some basic cause behind that underweight problem. Two or three simple examples before starting our actual discussion. Let me tell you, when the patient comes to me and say, for example, doctor, I am not having the desire to eat, but rather I am feeling little bit nauseating and severe uncomfortable feeling and little bit feverish also. Then I will ask you how many days you are feeling like this. And if he said just doctor 4 or 5 days, absolutely my hunger has gone or any desire has gone, even I don't want to smoke, even I don't want to do the sex, then I immediately ask to lie down, and when I examine, I find the liver tenderness. Immediately I get it in my mind that this patient is suffering from infective hepatitis or jaundice. Then I immediately ask the patient to do the urine examination, or say especially the blood bilirubin level, and also just warn them that I am not sure, but it is possible that you may have the jaundice-like problem. There is a inflammation to the liver. So just relax and take the sufficient rest. And then within 1 or 2 days, you may start looking yellow discoloration of the eyes or yellow discoloration to the urine. So don't get afraid, don't get tensed. That is a normal in the jaundice, and we will treat you properly. If the same patient complains me, since last 4 5 months I am not feeling to eat, and then I am having little bit evening type of feverishness in my body and totally weakness and intermittent cough is there, then I may suspect that the patient may be suffering from tuberculosis, and I immediately ask him to do the chest X-ray. Another case, if I find that since last 6 7 months, doctor, all of a sudden this my uncle is losing weight, and he has some problem for urination also, then I may suspect in my mind this person may have some etiology like a prostatic enlargement, and that may be because of the cancer. So cancer type of the patient also lose the weight with in addition to the anorexia. So what I mean to say, when I stamp that this particular person has a food deficiency, or he is not taking enough proteins or the carbohydrates or the fat, and that is why he is underweight or not taking regular exercises. But before that, we must be sufficient enough confidence that there is no any other serious problem with that underweight problem. Unless and until otherwise, just asking to massage yourself and take the one pass, that's it. This is not the right policy when we are treating the patients of underweight. Let us start to discuss this problem. This problem is as serious as like obesity problem, at least for some percent of the people in the society. So don't neglect that problem. Okay, so we are talking about the underweight. That means weight then less than expectation, like you with your comparison to the height with your age, and then your weight is definitely low. Then we have to think about it. What is the problem? Exogenous causes outside the body, inadequate intake of the food. For example, the patient may be suffering from loss of appetite, he is not feeling to eat, anorexia, then starvation, then dietary fads. Some people are thinking that I must look like a very thin, especially the young ladies, they are thinking in that way, and that they are doing the excessive fasting, and that causes not only the weight loss, but also they will start to get the vitamin deficiency or the mineral deficiency, and then they suffer from anemia and another complaint like calcium deficiency, the bone weakness, backache, and all these things. Then perverted appetite, then chronic alcoholism. Alcohol is the main problem for the anorexia. Drug therapy, some medicaments like for example tablet rifampicin or some antibiotics, they lost your desire to food. Antibiotics, inability to swallow. There may be some structural or pathological problems due to the lesions of the tongue. For a simple, like just last year, 2 days back, I have the video like stomatitis. So stomatitis, the patient cannot eat, and recurrent stomatitis. Then there may be some tumor. There may be tongue cancer also, palate. There may be paralysis, tumors, inflammation, and perforation. Pharynx, that is paralysis, tumors, inflammations. Esophagus, stenosis, tumor, acalcia, and a foreign body. Especially elderly person, if the day by day he's telling to you that, see, my child, that I'm not able to swallow. First, he will start the solid food. He cannot swallow, dysphagia, and gradually after 1 or 2 months, he will say, Doctor, now even I cannot tolerate, I cannot swallow the water also. This is a very serious indication. Take him to the doctor, and there some esophagoscopy, etc. Test has been done, and you will find that there may be problem like esophageal cancer. So be careful for that matter, or esophageal varices also because of the liver problem, alcoholic problem. Next is a inadequate absorption or utilization. For example, the patient is suffering from chronic diarrhea, maybe because of the lack of enzymes or bile, lack of hydrochloric acid and pepsin. There may be malabsorption syndrome. There may be roundworm, threadworm, hookworm, tapeworm, intestinal parasites, excessive elimination of or abnormal loss of the whatever the nutrients that we are taking. There may be uncontrolled loose motions, uncontrolled vomiting problem, fistulae, and the burns. Now we will see about the endogenous causes. Inside the body, there may be some pathology. Here are some of the examples. Rare causes. These are not very common causes. Endocrine disorder like Addison's disease, thyrotoxicosis, excessive thyroid secretion, diabetes mellitus, and Siemens disease. Hepatic problem like cirrhosis of the liver and liver abscess. Respiratory problem like pulmonary tuberculosis, TB, chronic lung abscess, or bronchiectasis. Blood diseases like leukemia, cancer of the blood, Hodgkin disease, cardiovascular heart problem like malignant hypertension, subacute bacterial endocarditis, kidney diseases like chronic nephritis, pyelonephritis, brain problems like progressive muscular dystrophy, malignancy, cancer of the stomach, bronchogenic carcinoma. Then, of course, the psychosis, that is schizophrenia and anorexia nervosa. But when you diagnose anorexia nervosa, this is a diagnosis of exclusion. Remember this word. You have to rule out all the previous causes that I have discussed, and then you stamp that no, it is only psychological, that is anorexia nervosa. Drug addiction and the collagen disease, these are the different causes for underweight or low weight problem. So you have to do the hemogram and ESR to rule out the acute or chronic infection, which you can determine from the WBC count, because white blood cells are soldiers. Normal count is 4 to 10,000 per cubic mm. If it is more than 15,000, mild infection, more than 20,000, that is moderate infection, more than 25,000, severe infection. At the same time, hemoglobin level, normal 12 to 14 gram. If it is less than 10 gram percent, mild anemia, less than 7 gram percent, moderate anemia, less than 5% can cause cardiac arrest. Be careful. Admit a patient, give the blood transfusion. LFT, liver function test, to check the liver pathology. Kidney function test like urea and creatinine, blood test. X-ray chest PA view to rule out the tuberculosis. T3 and T4, thyroid problem, blood sugar, fasting and post glucose for not non-diabetic, and fasting and TB postprandial after food exactly after 1.45 minutes, 1 hour and 45 minutes. You must give the blood after food, because otherwise the results may change or the results may not be correct. So even you can do the glycosylated hemoglobin to check the average of last 3 months in blood sugar level. Now, what can be the treatment? First, of course, Sankshepatāh Kriyayogo Nidana Parivarjanam, to rule out any pathological lesion problem like TB, cancer, HIV, behind that anorexia, behind that underweight, treat that original cause. Then symptomatic treatment, Arogya Vardhini. This is the best tonic for liver. The main 50% ingredient is a Kutaki. Picroheza kuru. It gives the stimulation for all protein, carbohydrate, and fat metabolism because liver will be more and more strong. Then Kushmandapak is a nutritive material, nutritive, like a food supplement. Kushmand is a gourd. Or Badam Kalp from Hari Parshuram Aushadhalaya Pharmacy by Khadiwale Vaidya from Pune city. 2 teaspoon 2 times with milk. Then next prescription for underweight. Can you see here? Amruta Prasha Ghrita, again from Hari Parshuram Aushadhalaya Khadiwale Vaidya Pune city. 2 teaspoon 2 times in a day. Ashwagandha Rishta, 4 teaspoon with equal amount of water 2 times after food. Ashwagandha Pak jam, 2 teaspoon 2 times in a day with milk. Next prescription, my dear friends, for underweight, low weight problem. Shatavari Kalpa, 2 teaspoon 2 times in a day with milk, Purnan. Then Madhumalini Vasanta to stimulate the muscle metabolism. Muscle mouse Dhatvagni will be stimulated by Madhumalini Vasant. It contains the eggs also. Okay, 2 tablets 3 times in a day. Then Himmatavati by Hari Parshuram Aushadhalaya Pune from Khadiwale Vaidya, 2 tablets 3 times in a day. Then Dhatu Paustika Churna, 1 teaspoon in the morning with ghee. Then the next prescription, Chavanaprash, 2 teaspoon 2 times in a day with milk for underweight problem. We are discussing underweight, low weight problem. Then you can see the Prashodaya, that is a 2 teaspoon mixed with hot milk. Then Makaradhvaja tablet, 1 tablet with milk in each morning. Then Balapushti, Ayurveda Seva Sangha Nashik, 2 teaspoon 2 times in a day with milk you can take. Then Patya, which is also important for the gaining the weight, nutritious food and morning breakfast. My dear friends, underweight is a problem of Vata Prakopa. Underweight is a problem of Pitta Prakopa. Or underweight is a problem of Vata Pitta Prakopa. So you must know the Vata qualities like Tatra Ruksho Lagu Shitaha Khrasukshmascharo Nila. If you are taking too much dry substances, then what you can say, the Ruksha, dry, cold stuff, not freshly cooked food in the house. Always you are out eaters, and then there may be late going to the bed, no proper sleep. Sleep is also important as a growth factor, this hormone is secreted by anterior pituitary gland, and that growth hormone will only activate, will only show its normal function of nutrition and growth when you sleep, you get the sleep properly. 6 to 7 hours sleep at night is very much essential for recharging our battery. If the person is sleeping late, then how much tonics he will take, he will not gain the weight, or weight gain will not be sustained. So lifestyle modifications, food modifications are must. Eating too much spicy and chili and pungent, sour, salty, pungent, sour, salty, these taste, TASTE, are very, very degenerative. So we have already Dhatu Kshayajanya Vata Prakop. We understand? So to control that, we have to modify our food and lifestyle. Adequate rest, adequate exercises, both should be balanced. Okay? So regular exercises, proper physical and mental rest, regular bowel movement, no constipation, no amoebiasis, no giardiasis, massage, full body massage with Chandana Bala Lakshadi Tail every day or at least weekend or at least once in a month. Basti course under a guidance of Ayurvedic Vaidya, that is called as Yapana Basti. Yapan Basti, Rajyapan Basti, best for nourishment. Plenty of this type of the food stuff like milk, dates, wheat, eggs, banana as per the digestion capacity. So my dear friends, like obesity, you must consider underweight is also a problem for some sector of the society, and we must try to find out the exact cause and treat it very scientifically. Thank you very much once again, and see you in the next video. Till then, I wish you all the best. God bless you.